There are multiple questions that come to your mind when it comes to COVID infection. Everywhere the news flashes, somebody with fever, cough, and breathing difficulty is likely to have a COVID infection. So, does that hold true for everyone? Let me take you through three examples. One is a young male, second is a middle-aged gentleman, and the third one is an elderly individual. As far as the young male is concerned, he's a 19-year-old boy suffering with fever and breathing difficulty for past 2 days. Secondly, it's a 42-year-old male who is a known asthmatic, is having fever and shortness of breath for past 2 days. Third one is an elderly gentleman who is a 72-year-old known hypertension, heart disease, and a kidney disorder patient, and all of a sudden gets up from his sleep with shortness of breath. So, amongst all three of these, whom do you feel is the person who is likely to have a COVID infection? Kindly drop in your answers in the comment section box. All the three individuals are suspected to have COVID infection. So that is your answer. So all those who have selected either A, B, or C score a point for that. So from the above example, let us understand patients who are at high risk for COVID infection. Patients those who are elderly beyond the age group of 60 years. Secondly, patients those who have previous medical problems in terms of diabetes, heart-related problems, kidney-related problems, or lung infections or lung disorders. Moreover, patients those who have cancer and on immunosuppressive therapies are at high risk for infection. On the other hand, that does not mean patients who do not have any of these problems or patients those who are young are not going to suffer from COVID infection. You are the best judge for yourself. You know your symptoms better than even the doctors. So, an asthmatic knows how he feels when his attack precipitates. A patient with a cardiac disorder knows when his attack gets precipitated. So, but whenever any of the previous examples that we have discussed earlier report to the hospital, they all would be guided to the respiratory area. In the respiratory area, we follow a dictum that any patient having either fever, cough, and breathing difficulty is suspected to have COVID until and unless proven otherwise. Each coin has two sides. After every dark side, there's a brighter side waiting for us. One fine day, we'll definitely conquer COVID infection and we will be victorious. At this point of time, I would just sum it up by saying, stay indoors, stay safe, and stay healthy, and take good care of yourself.